Okay, so hello and welcome to iTenif Healthcare Solutions webinar. Today we're excited to share our Not Another HIPAA Compliance webinar with you. My name is Chelsea Grover and I'm the Marketing Communications Coordinator for iTenif. I'd like to take a moment to explain the process for today's presentation. First, I'd like to mention that this webinar will be recorded. We're going to send out a copy of the slides and a recording within the week of these as well. Next, for those of you who aren't familiar with iTenif, I wanted to share a bit of who we are with you. We specialize specifically in NextGen Healthcare. We're good at getting data into, out of, around, and through NextGen. Basically, our goal in life is to make delighted clients by helping them get the absolute most out of their NextGen software investment. We're passionate about providing solutions for our healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen, and we also have two NextGen add-on productivity solutions, ChartGuard and Refund Manager. Next, I wanted to mention that we have an upcoming educational webinar on March 15th. Today is electronic data interchange, so much more than claims. In that webinar, we're going to explore today's EDI capabilities, including appointment reminders, statements, collections, patient satisfaction surveys, real-time scheduling, patient outreach, population health integration, and so much more. I'll be sending out an invitation later today on that, or you can register directly through our website on the Events and Education page. Okay, so back to today's webinar. At the end of the presentation, we're going to open the floor up to questions from you. We'll answer all the questions at the end, so you can type them in the questions area of the webinar control panel whenever they occur to you. And for audio clarity purposes, everyone's phone is going to remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions can be entered in the questions box. So without further delay, I'd like to introduce our presenter for today. Chris Floros is Managing Consultant of Security and Compliance at iTenif Healthcare Solutions. He truly lives and breathes HIPAA compliance and is a great resource. Also, Chris Werfel, our Vice President, is on the line and can be available if needed. So Chris, I'm going to go ahead and pass the webinar off to you. Please feel free to get started when you're ready.
Great, Chelsea. Thank you for that introduction. I appreciate that. Welcome to our webinar on lowering the cost of HIPAA compliance. We've been working with HIPAA regulations since they were released and have helped many groups develop and implement compliance programs into their organizations. Today we're going to try to define the trends we're seeing and the risks of dealing with HIPAA and ePHI, and after that we'll discuss some of the solutions we have developed that help mitigate those risks and can help streamline and automate some of the tasks required in your compliance program. I think at this point we've all been presented with the purpose of HIPAA Security Rule many times. I would be remiss if I don't include it. So at the end of the day, the purpose is to ensure that every covered entity has implemented safeguards to protect the confidentiality, integrity, and availability of electronic protected healthcare information. If you've never been beaten with a HIPAA compliance hose, a quick Google search will return tons of information for you to enjoy the experience. One of the things that we see when we speak with covered entities about compliance is what we'd like to call a check-the-box mentality. The thinking is, I know this stuff is mandated, I don't want to have to deal with it, but I will because I know I need to. I just want to implement the bare minimum, check the box next to completed, and move on to the next project. Unfortunately, it really shouldn't work that way. I wish I could tell you this process was this simple, but the truth of the matter is I like to consider HIPAA security compliance as really a journey and not a destination. The reason for this is that the landscape involved in the process is ever-changing. I'm sure you've all seen the conceptual risk equals threat times vulnerability times impact formula. The risks, threat vectors, vulnerabilities, and impacts in your environment are constantly changing, and the security posture of your organization really needs to be vigilant in the consideration and mitigation of these changing factors. It's really a difficult problem to overcome because many of the targets are moving. We have to protect our environment not only from external threats like hackers, but also from internal threats like IT support personnel making unauthorized changes to different pieces of equipment, or even our users clicking on that irresistible link in the unsolicited email that causes a huge problem. We ask ourselves why the risk to patient data is so high. The truth is that the bad guys out there are motivated by value in the same way that the businesses are. Stolen data is traded on the black markets the same way legitimate investors trade commodities. Credit card data has a black market value of between 25 cents to $1 per record, where patient data, on the other hand, is worth between $10 and $50 per record. The reason for the discrepancy is really the nature of the records. I like to look at stolen financial data as think of it as having a shelf life. As soon as I report my stolen credit card number, my bank disables the card, changes the number, making the information useless. Patient data, on the other hand, is what I consider shelf-stable. The data doesn't change or expire. Unfortunately, you can't change your Social Security number even if it's stolen. Whenever I think about this, I think of the quote that is attributed to Slick Willie Sutton, who was a bank robber from the 50s. When a reporter asked him why he robbed banks, he replied, "I rob banks because that's where the money is." You know, we're seeing increased attacks on patient data because for the bad guys, that's where the money is. Next, let's talk about trends we're seeing in breaches. 2015 was really a banner year for breaches and saw 113 million patients affected over 270 breaches. This was many multiples larger than breaches for previous years. The thought at the time was that the 2015 numbers were being skewed by a single Anthem breach that affected over 80 million users, just a huge single breach. The idea was that we thought that those numbers would go down in subsequent years. In 2016, we saw that the patients affected number did drop to 14.3 million, while the reported breach number dropped also, but a little bit smaller than expected. So what we saw in 2016 was consistent with what we expected. There was a drop in the number of breaches and patient lives affected in 2016. What we didn't expect to see was the alarming increase in the dollar amount in fines. In 2016, $22.84 million in fines compared to $6.1 million in 2015, almost 4 times as much. You might be asking yourself, what about 2017? As of the end of January, which is the most recent numbers I have, we're already up to $2.6 million in fines, covering just 2 breaches for 2017. So it certainly looks like this trend is going to continue. I think that as the enforcement engine of HIPAA, the HIPAA rule matures, we're going to continue to see a rise in both the reported breaches and even more alarmingly in the rise of penalties associated with those breaches. Next, I'd like to talk about a group called the Ponemon Institute. They're a group that conducts independent research on privacy, data protection, and information security policy. In a 2016 report that was sponsored by IBM, they released a global study on the cost of breaches. This study is interesting as it broke down breaches by not only country but also by industry, so let's look at some of these findings specifically for the U.S. Ponemon calculated the total cost of a U.S. breach for financial sector is $221 per record. Compare that to their estimate of $355 per record in the healthcare sector, or 60% more than financial records. It's clear that the healthcare records represent a much larger value and higher corresponding liability, making them a larger target. And also in the study, Ponemon estimated the probability of having a breach in the U.S. is 24%. So almost 1 in 4 of us could be facing a breach in the coming year, which is a pretty scary number. The final statistic puts 50% of the breaches caused by criminal or malicious attack. I think we often focus on the bad guys when we're talking about envisioning a breach or looking at security, but the truth of the matter is that errors and omissions from our internal people account for really a larger threat vector. Part of this 50% number includes internal mistakes that either open the door to a malicious attack or cause the breach itself. Things like misconfiguring a server or router, clicking on a malicious software link, or leaving an unencrypted laptop in the backseat of a car have all resulted in large breaches with corresponding large penalties. Most sources that I see point to internal users as the largest source of breaches. To properly gauge the risk, I've done some of the math for you here, depending on the size of the practice. I've done the math for 10,000, 25,000, or 50,000 patient records. As you can see, the value of the breach quickly escalates into some very large numbers depending on how many records are affected. So very quickly you can get up into the millions of dollars for even practices that don't store that many records. So now that we're all sufficiently bummed out at the size of the problem in front of us and the liability we face, the question is, how do we protect ourselves going forward? I would say the single most important place to start is with a comprehensive security risk analysis. This HIPAA mandated item is an opportunity to take an objective look at the system in the organization and methodically identify and rank risks to data loss. This will give us the roadmap that we need for what we need to address in our security programs. Once we have our comprehensive risk analysis completed, the information we create should flow into the development of a remediation plan for any gaps in compliance. These plans should address risks in order of rank and represent our good faith efforts to remediate or mitigate those risks in a timely fashion. There's a big tendency after a security risk assessment to breathe a big sigh of relief because it's almost like a birthing event. And once we're done, we want to just take a big break. And what I see a lot out there is that I've seen a lot of entities miss this important step of actually going on to their remediation plan and keeping that momentum moving. Documentation and remediation of items should lead to creation and maintenance of evidence of compliance for all items. I often in practice see a dust-covered list of policies and procedures in a corner of a practice, and when we ask them to provide documented evidence that they're following those stated policies, many of them can't do so. Our policies and procedures really need to become ingrained into our employees' culture, and we need to be able to produce demonstrable evidence that policies are followed. Without valid control mechanisms, even the most common sense rules will fade over time, so really accountability is key. If we get audited, this information will need to be produced within 10 business days, typically, to be responsive. The time to collect this information and to get all that stuff together is before you get the audit notice. We need to also monitor for changes in our environment that present new risks. We often add procedures, work with new partners, change existing technologies, or even add new technologies. Each of these events opens us up to new threats and vulnerabilities. There's a widely publicized case of a state health entity that simply replaced an outdated server on the network. Not a big deal. Through a misconfiguration, they opened that server up to the public internet so that when patients did a simple Google search on their names, the results window included links to their private healthcare documents for the world to see. Pretty scary, but it actually happened. Also, during that investigation, it was determined that that server was available on the internet for over 6 months. So not only did it happen, but it was left that way for quite a long time. This case led to additional guidance being added from OCR so that when we do now risk analysis, we look at the fact that we have to consider security impacts of any change we make to the environment or any addition to technology. It's really important we monitor for these changes because it's very simple in today's age to be able to not consider security at the end of a process. Finally, just like it says in the shampoo bottle, when we get to the end of the process, it's time to restart from the beginning in order to continuously address the changing scope of our environments. We have to rinse and repeat. So the challenges we face to managing the risk progress includes many. The first is regulations provide the what without the how. We have to apply the best practices in order to be able to do what we need to do, and the hard part of that is really being able to determine what those are. Best practices are, it depends on what you can research out there, and you have to make sure that you apply them in the right procedures. Second challenge we face is monitoring the volume of information generated through the audit logs. The amount of information we need to review is so large, finding what we need can be very difficult. A good example, Attentive has a lot of NextGen users in our client base. NextGen provides the NG audit feature to capture a lot of this information. It's a great tool. The best part of this product is the sheer number of events it captures. The worst part of the product, you guessed it, the sheer number of events it captures. This is true of much of the logging we do in IT. It's often really hard to see the forest for the trees because there's so much information to wade through. Additions and changes to technology often go unnoticed and open us up to additional vulnerability or loss. In many cases, it's difficult to keep track of what our employees are doing each day on a day-to-day basis to keep things running or even integrate new requirements. Each of these changes or additions could potentially open us up to additional vulnerability. Finally, our day jobs tend to get in the way of having time to tend to this. Very few of us have security as the only thing we're responsible for, so we need to incorporate this need into our already jammed day, which makes things very difficult. As a result, managing security and compliance can make you feel like a lone couple trying to herd cats up a hill. This slide really tickles me, so I felt compelled to put it in. In our invitation, we promised you that this wouldn't be just another HIPAA compliance webinar, and to that end, Attentive offers a set of services and low-cost, high-value tools that can genuinely reduce your cost of compliance. Firstly, we can help streamline your security risk assessment process. A risk analysis is the cornerstone of your security management initiative, and Attentive can help you complete a comprehensive security risk analysis leveraging cloud-based tools to streamline the process. Our solution contains a set of interviews which cover all 78 HIPAA required elements, making sure that each one is addressed and accounted for. Our experienced analysts are there to help you along the process to answer questions and review responses to ensure an accurate representation of what is being done is recorded. Once the interviews are complete, our process identifies and ranks all gaps in compliance. The entire process is documented in the cloud for easy retrieval in case of audit or for senior management review. It's important to note again that if audited, timelines for producing documentations are really tight, so having this information at your fingertips is really the key. Our security risk analysis also incorporates remediation planning into the process. Each gap in compliance is rated according to NIST guidelines. Our analysts help review each risk item and develop a remediation action plan for each. The cloud portal also includes an action plan section your staff can use to record progress and upload documentation of issue remediation. The online portal acts as an active repository for the information and includes email reminders to help staff stay on track with remediation efforts. The combination of all of these items serves to document our good faith efforts to remediate these issues we identify in our security risk analysis. Again, in the event of an audit, you can quickly produce required documentation within that time frame. I know I've mentioned it a couple times, but that time frame again is 10 business days, and it's just a really tight time frame to produce a large volume of information. So having it ready to go ahead of time is really important. As I mentioned earlier, Attentive also provides tools to bring it all together. We offer a suite of compliance tools that help you focus on securing the environment and automating the process of detecting and remediating and evidencing your compliance instead of spending your time figuring out how to search for data. Firstly, we have the cloud-based risk assessment tool we just discussed. As a quick reminder, the tool organizes the risk assessment through role-based interviews covering all HIPAA requirements. It acts as a repository for questions, answers, and documentation, and also tracks and drives your remediation plan throughout the year, keeping everything in your fingertips in case of an audit. Going back to our earlier discussion, the amount of data we need to monitor is huge, and the targets we aim at keep changing. The remainder of the solutions we have take the form of a solution that sits in the four walls of your organization and helps you provide insight on exactly what's happening from a security perspective. In examining this problem, we really identified two main needs. First is reporting. We have an agent-based tool that monitors your servers, networks, devices, and applications, and it identifies and logs security events that you should be reviewing on a regular basis. These are all pieces that are to the HIPAA puzzle and becoming HIPAA compliant. We can customize these reports to ensure that they provide only the relevant items that map to specific security policies and procedures. Some of the reports that we can generate include users that have not accessed the network in a certain number of days, allowing us to identify accounts that may no longer be in use but still enabled, user accounts that violate security policy, which allow for identification of accounts that can be or have been compromised, any significant changes to the security level of accounts, which allows us to identify those accounts that have been granted administrative access for review and verification. We can look at group memberships and access allowed to those groups for periodic reviews by the data owners to make sure that we have the right people in the right groups. And then finally, another example would be Active Directory security settings for periodic confirmation. All this information gets automated, and we can have those reports come out to several different individuals so that we can be reviewing that stuff on a regular basis. A lot of the requirements in HIPAA require that we're able to take a look at those documents, and that after we've identified groups for people and put people in the right groups, how do we make sure that we keep those people in the right groups and that we constantly are checking to make sure that nothing gets changed which is unauthorized. Reporting is great, but we're all continually inundated with reports from all the facets of organizations. And those reports often don't get the scrutiny they deserve because we just don't have the time. So we really are looking for a mechanism to be able to separate, the wheat from the chaff and be able to look at what we're supposed to look at. The next piece of our puzzle really is the alerting side. In this aspect, we have a device that continually monitors the environment and allows for real-time alerts of any security-related items. It can be customized and alert on items like, the first one is really, really important. ePHI appearing in unauthorized locations. We all purport to have a good handle on exactly where ePHI lives in our practices. We know that it's here and it's there, and when I go through and do a lot of these audits, I have a lot of folks tell me that there's no PHI in any of my workstations. What we do see is that very often individuals download and store ePHI in unauthorized or unanticipated locations, and if we don't know where they are, we can't really take the steps to be able to protect those. So this device can actually go out now and scan all devices on your network, and it'll alert on any device that contains ePHI, which might be outside of the protected list of devices that we have. This is really huge to be able to do this, and it doesn't look for just titles of documents. It actually does a deep scan into all the devices to identify anything out there that could be ePHI. Other things we can look at are key configuration changes to highly sensitive servers or workstations, any configuration changes to network equipment that should be properly vetted. It's very often the case that sometimes, and this will happen a lot of times in case of an outage will happen and the IT department scrambles to be able to do whatever they can to be able to get things back up and running. Often some of those things they do to get back up and running might violate some of our security policies if we don't properly vet all of those changes. This device can help identify any of those things that change. Internal and external vulnerability scans to ensure all equipment is secured as expected while pointing out any new or misconfigured devices. Obviously there's a theme here, right? It's not always malicious attacks that make us vulnerable. Sometimes it's just mistakes that people make that open us up to a lot of liability, so we're trying to look to capture a lot of those misconfigurations. Identification and scanning of all internal nodes to ensure things like patch level, antivirus, software, device encryption, and anti-malware are all in place and active. A lot of us are already deploying a lot of those technologies. The question is, are we doing a good job at being able to monitor to make sure that those things are always up and active, and can we prove those in case of an audit? Finally, the other one we can do is finding new unauthorized devices connected to the network. It's very easy for somebody to be able to go through and be able to plug in a new device on the network that will go unnoticed. This device can go through and it'll send an alert anytime that happens. So the last part is, after these alerts, we can send these alerts to your ticketing system, or they can be emailed to the appropriate individual. The important part is they contain actionable items for these individuals to address. People don't have to review a report to find out what needs to be done. The alerts and then the subsequent remediation of those issues can then become a documented part of your compliance program and provide evidence of active compliance with your stated policies and procedures. Remember talking about NG audit earlier? If you have a policy that states, and you should have a policy that states, that you do a periodic review of patient information access, that review of users accessing the system within a certain window or time frame, our tools can completely automate those reviews and notify you if and when action is needed. The biggest message I want you to take away from today is that I don't want you living in fear of an audit. Remember earlier when we talked about that check the box mentality, that really isn't the goal. Our security and compliance efforts are really about protecting our patient data. We need to focus on due diligence. Have we carefully considered the threats and vulnerabilities in our environment? And due care. Have we implemented and verified all that is reasonably required to avoid a breach? So at this point, that's most of the information I wanted to get through. If you have any questions, we can certainly go ahead and post up those questions here for Chelsea. If you have any questions about what we discussed today, you're more than welcome to contact me at my email address or direct phone number, which are up on the screen here. And I appreciate everybody's time. So if we can open up the questions, Chelsea.
Hey, Chris, thanks so much for that. That was a lot of information, and I'm sure that, that many of our attendees are trying to absorb it all in right now. So as a reminder, I will be sending out copies of the slides and the recording within the next week, so keep your eyes out for that. And Chris's information is up on the screen. I know he's more than happy to answer any questions you might have, either via phone or email, or you can always reply back to my emails. I'm the one who sends out the invitations as well as the follow-up emails. So any way you can get a hold of us, we're happy to answer questions. So at the moment we only have one, but you can type any of your questions in the questions area of the webinar control panel if you have any right now. Otherwise we'll also hang on the line for a few minutes just in case somebody's in the middle of typing one. So the question is completing the security risk analysis something we can do on our own, or does it require an outside firm?
That's a great question. It's certainly, from HHS's perspective, it's certainly something you can complete on your own. The only caveat that I would say is that these rules are really changing, and OCR is also releasing guidelines on a regular basis for their expectation for some of these rules. So when you do the assessment on your own, sometimes it's not, you want to make sure that you have the most complete information. It's kind of like, certainly you can fix your car yourself, but sometimes it makes sense to validate that everything is done properly by using somebody who's actually been through it and kind of has access to the best practices. You also want to really make sure that it's a complete and honest assessment that covers all the, there's I think 78 different areas of HIPAA that need to be represented, so we need to make sure that we're looking at those. A lot of times what we can do is help people through some of the best practices around what those rules are actually pointing for and what people are doing to be able to protect themselves.
Awesome. Great analogy. Thank you, Chris. And again, thank you everybody for joining us today. Thanks for taking your time away from lunch. Feel free to reach out to us with any questions. Keep your eyes out for that email from me about the EDI webinar that we're going to be presenting at this time next week. That should be a great one, educational based. So we hope to see you there. And I hope everybody has a great day. And if you're in the Chicago area, stay out of that wind. It's getting crazy out there. Thank you all and have a great day.
Thanks, everyone.